Hey mama, have you ever been walking, getting out of bed, or changing positions when suddenly you have this sharp shooting pain down there that stops you in your tracks? That sudden electric stabbing sensation is often described as lightning crotch, and yes, it can be pretty intense. Hi, I'm Dr. Anna Towne, pelvic floor physical therapist, prenatal and postpartum exercise specialist, and a mom of almost 4. My goal is to help you feel strong, supported, and confident going throughout all of pregnancy and postpartum. And before we jump in, if you are looking for pregnancy-safe workouts and pelvic floor guidance, make sure to subscribe and turn on notifications. All right, mama, let's get into it. But first, I want to quickly clear up what we mean when we say lightning crotch, because sharp pain in this area during pregnancy can actually come from a few different sources. True lightning crotch is often described as a quick electric jolt or a stabbing sensation in the vulvar region. It is most common during the 3rd trimester when your belly is growing bigger and baby is moving down into your pelvis. As your baby moves, rolls, stretches, kicks, or changes position, that might put sudden pressure on or near your cervix or your surrounding nerves, creating that sharp electric sensation. That pain is typically very brief and goes away quickly, but it can definitely catch you off guard. Pain in this general area can also be related to pubic symphysis pain, or SPD, which is felt in the front of the pelvis or groin, or related to round ligament pain, which can cause sharp sensations through the groin as the ligaments supporting the uterus stretch and respond to movement. So if you've been searching for lightning crotch because you've been feeling sudden, sharp pain somewhere in your pelvis or groin area, you may not know exactly which one you are dealing with, and that's okay. I have separate videos where I go in more depth on groin pain or pubic symphysis pain, as well as round ligament pain. I'll link to those below if you'd like to learn more. But for this video, you don't need to know exactly what's causing your pain to follow along. We're going to go through simple, gentle exercises that will help you reduce the pressure through your pelvis, improve mobility, and help you decrease how often you experience these sharp, jolting pains. While there isn't just one exercise that can guarantee lightning crotch will go away completely, there are things you can do consistently to help your body feel more comfortable and more supported. These exercises are designed to improve mobility through your pelvis, reduce unnecessary pressure, and help decrease how often you feel these sudden jolts and how intense they can be. Here are 5 simple exercises you can start incorporating into your week. Go ahead and grab a small ball and put it in between your knees, laying on your side here. And if you can, have your feet up against a surface like a wall. And we're gonna be doing hip shifts. So you're gonna shift your right hip forward and then your left hip forward. Right hip forward and left hip forward. As you shift back and forth here, I want you to focus on inhale and exhale. Inhale through your nose, exhale through your mouth. You're going to be feeling your inner thighs work here as you push that ball back and forth here. Hip shifting right forward and then left forward. You don't have to squeeze the ball hard here. Just gentle pressure is enough to get those inner thighs working. It's just a great pelvis mobility exercise to get pelvic floor to relax, to get glutes to relax, and to get those inner thighs engaged. Couple more here. All right, let's go ahead and switch sides here. So take that ball, roll on over to the other side. And again, if you have a surface to put those feet up against, that will be helpful. Have that head supported either in your hand or on your arm. Inhale through your nose and exhale through your mouth as you shift right hip back and right hip forward. So we're gonna feel both inner thighs working here as you really try and stretch that knee as far forward as you can and pull that knee back as far as you can. This is a great exercise for that pelvis and hip mobility, and again, inner thighs, which come and attach to that pubic bone. So this can really help minimize that lightning crotch pain. Almost there. Nice job. Go ahead and join me in a half kneeling stretch here. So right leg back, left leg forward, and we're gonna reach our right arm up towards the ceiling. You're gonna do a slight posterior pelvic tilt, tucking your pelvis underneath you, and then shift those hips gently forward. We're gonna inhale through our nose. As we exhale, we're gonna slightly shift those hips farther forward, and we're gonna reach that right hand up towards the ceiling and over towards our left side. So inhale through your nose, exhale, stretch into that right side body opener. Inhale through your nose, exhale, lengthen that right side body as much as you can. Inhale. Exhale. We're creating space through that right side. So we let baby have room to move. We're not feeling as crammed down in that lower pelvis. One more here, exhale. All right, let's go ahead and switch which leg is forward. So left leg is back, right leg is forward. Again, slight posterior pelvic tilt. This just helps us prevent getting in that forward position with that pelvis, which we already are in pregnancy a lot with that belly hanging out. We wanna tuck that pelvis underneath us. Left hand up towards the ceiling. Inhale through your nose, exhale through your mouth. Reach left arm up towards the ceiling and over to our right side. Inhale through your nose, exhale. Stretch a little bit further here. Feeling really good opening up that left body. Inhale through your nose, exhale. We're also feeling lengthening through the hip, the front of the hip. We're stretching into those hip flexors here. Almost there. Inhale, exhale. Nice job. Go ahead and grab a yoga block or a small towel roll to put underneath your right knee, and then your left knee is bent in front of you. You're gonna push your right knee down into that block or towel roll as you lift your left knee up off of the floor here. Hold and slowly come on down. So as we push down on our right knee, we're gonna feel our right inner thigh, and as we lift our left knee up, we're gonna feel our left inner thigh. Hold for a couple seconds and slowly come back down. You're gonna also be feeling some outer glute engage, which is great for pelvic stability. As we have those hormones affecting our pelvic stability, it is good for us to strengthen those outer hips as well. So inhale through your nose, exhale, push down right inner thigh, lift up, left knee, getting that left inner thigh to engage. Couple more here. Always want to make sure we're breathing and not holding our breath here. Last one on this side. Exhale. All right, let's go ahead and switch sides. Let's see if we notice any difference between the sides, because often we'll have one side that feels easier or harder than the other side does. All right, so make sure you get set up. Left knee is on that foam block or towel roll. Right knee is bent in front of you. Inhale through your nose. Exhale, push left knee down, lift right knee up, hold there, and then slowly come back down. So pushing knee in to that surface as much as you can. That's gonna get that outer glute to engage and that inner thigh to engage at the same time as we lift right knee up, getting right inner thigh to work. This side is hard. Again, see if you notice any differences between this side and the other side. A lot of us have differences or asymmetries between the sides, and it's important for us to pay attention to those. Last one here. Awesome job. Go ahead and grab one heavy dumbbell for this exercise and put it in your right hand as you lengthen your left leg out behind you. You're gonna inhale through your nose. As you exhale, hug baby, pulling baby up towards spine. As you row your right weight up towards your armpit and lift your left leg up off of the floor. Inhale down, exhale, lift. Inhale, exhale. So we're working cross body here. So we're using left glute and right shoulder blade muscles and core to stabilize us in between those movements. Inhale down, exhale up. Keep breathing here. Now we're gonna head over to the other side here. So weight is in your left hand and extend your right leg out. We're gonna inhale through our nose, exhale through your mouth. So the focus here is not on the height of the leg because we wanna keep those hips pointing down towards the mat here, making sure that we're getting core and glute muscles nice and engaged here. So each time we exhale, you're hugging baby, pulling that core up towards your spine. Couple more. Awesome work. Last exercise, go ahead and grab your ball and lay on your back here. If you're starting to feel nauseous or lightheaded at all while laying on your back, then you can elevate your back on an ottoman or some type of elevated surface. But what we're gonna do is we're gonna inhale through our nose, exhale through your mouth, squeeze the ball, lift your hips up off of the floor, squeezing that ball, getting our inner thighs engaged and our glutes working. Hold there for a couple seconds and then slowly come back down. Inhale, exhale, squeeze, lift up, hold there for a couple seconds, and then slowly come back down. So we're using glutes or back of the hips to lift those hips up off of the floor. Glutes are such an important pelvis stabilizer for us. And then we're squeezing that ball, getting those inner thighs engaged. You shouldn't be feeling any strain or pain in the low back here. If you are, really make sure you're tucking that pelvis underneath you, getting that core engaged first, then push your heels, squeeze your glutes, and lift those hips up. That should really get those glutes to fire and that core to fire and keep the work out of only your back. One more here. Exhale. Squeeze, lift, hold, and slowly come back down. I hope this video helped you better understand what lightning crotch is, why it happens, and most importantly, helps you feel a little bit more hopeful knowing there are things you can do throughout the week that will help you reduce both the intensity and the frequency of how often this happens. While you may not be able to completely prevent every jolt, you don't have to just feel powerless when it comes to pregnancy discomfort. Consistently incorporating gentle movement and exercises that support mobility and help reduce pressure through your pelvis may make those uncomfortable moments less frequent and less intense. And if you want more guidance like this, that's exactly what we do inside the Strong Expecting Mama program. It's our pelvic floor PT design program built around the same pregnancy exercises I teach my patients in the pelvic floor PT clinic and personally that I trust for my own body. These workouts are designed to support your pelvic floor throughout pregnancy, help you navigate common pregnancy symptoms and discomforts, and prepare you for both birth and postpartum recovery. Click the link below to start your free 3-day trial and see if it feels like the right fit for you. Once you get started, use code YouTube10 for 10% off every month subscribed. And if this video was helpful, make sure to like, subscribe, and turn on notifications for more pregnancy-safe workouts and education. I'll see you in the next video.